Oh, that was fun. So my name is Sierra, and I'm a dog mom to Nina and Cora. I'm also a volunteer event coordinator with SheJumps, which is a local nonprofit organization. I'm joined tonight by my peer Teal, who's also from SheJumps, so I'm going to let her introduce herself.
Hi, everyone. My name is Teal Evans, and I am the Midwest Regional Coordinator for SheJumps.
Thanks for being here, Teal. So SheJumps' vision is to unearth the potential of women and girls through outdoor play and connection to nature. Our mission is to increase the participation of women and girls in outdoor activities to foster confidence, leadership, and connection to community through free and low-cost outdoor education. If you want to learn more about SheJumps and the events that we have coming up, you can follow us on social media and visit our website. Teal's going to share those in the chat so you can find those links. And you can also support our work and our mission by making a donation or purchasing some sweet swag from the merch store, like these Girafficorn stickers. They're awesome. Put them on a helmet, put them on a toolie box, put them everywhere. So tonight, we're learning about how to be your dog's first responder when adventuring outside. This talk is going to cover first aid for injuries, wildlife encounters, and environmental challenges. And we are so fortunate to be joined by Dr. Richardson and Dr. Smith from another wonderful nonprofit, Sage Compassion for Animals. I want to thank them both for being here tonight. We really appreciate them volunteering their time and expertise to teach us about this important topic. So I'm going to hand it over to Dr. Richardson now to talk a little bit more about SAGE, what they do, give us an introduction, and then dive into the meat of this presentation.
Perfect. Thank you very much. Yeah, Julie Smith and I are both small animal veterinarians. We're actually both boarded surgeons. We've been working together for a long time. So Julie's going to be helping with the chat. And I will say, SheJumps really speaks to me. Being outdoors was really what helped me survive high school and adolescence. I joined the Colorado Mountain Club and did all kinds of camps and backpacking. And it's really where just being outside, I found a piece of myself. Yeah, pieces of us everywhere, but I really love the mission. And we connected because through Sage Compassion for Animals. So this is a nonprofit. I'm one of the founding board members, and Julie's the executive director. And I'll go a little bit in our mission, but that's how the connection. So I gave a talk similar to this through Sage Compassion for Animals. And that's how we found SheJumps, or SheJumps found us. But to first kind of introduce who I am. So I am a veterinarian. I got my DVM at Colorado State University, and then I decided to do more training. So I did a year internship and a 3-year residency. So you're at the Animal Medical Center in New York City. Then I joined the UC Davis vet school and taught surgery for 2 years, and then ended in private practice in the San Francisco Bay Area here in the East Bay. And I've been there for 26 years, and Julie for a lot of them. Let's see if I can advance. Here we go. Sage Compassion for Animals is just a new nonprofit. So I'll go back. I'm now with our practice is called SAGE Veterinary Centers. And a little over a year ago, we, several of us from SAGE, but other members of the community formed a nonprofit to provide financial assistance for veterinary care to help people help their pets when the pets are in crisis. And our goal is also to educate people to try and lessen the amount of crisis out there. So while we share the name SAGE, two completely different organizations, SAGE Vet Centers did give us some seed money, but we have moved beyond that. I come by my knowledge a lot through vet school, but a lot through just life experiences. My 4-legged advisors include Great Danes, Collie mix, standard black dog. I had all kinds of animals growing up. As an adult, cats, a husky mix. You could see two of my dogs down here at the bottom. You'll see them a lot in the presentation. Learn a lot from them. I've spoken to lots of different groups. So I'm a regular presenter at Cover Your Canine. It's a first aid for police dog handlers. Spoken at given a first aid talk for the town of Lafayette here in the East Bay, and did a wilderness first aid talk at REI. Loved to talk in classrooms as well, and then gave an outdoor kind of a similar talk to Sage Compassion for Animals. Again, the more we can teach people, the more you know, the quicker you'll respond. Now, this is a talk modified by one that was put together with a lot of doctors from Sage. So we had criticalists and ER vets and myself all put together this talk, and then I continued to kind of modify it for the audience. I do not have any financial interest in any products. I pull in a lot of different things. It's just stuff I've tried. And this really is just information only. This is not medical advice for your pet. You are going to have to talk to your veterinarian for something specific to your pet. And there will be a chance for questions at the end. So, but write them in. Julie will be monitoring the Q&A, and she may be able to answer a bunch of things right off the bat. And she'll stop me if I need to do any further discussion. If I get off on some tangent, we'll be back. So we'll cover first aid kit suggestions, vital signs. There's some secret sauce, because in order, you have to know what to do, but you have to be able to do it to your pet as well. Some of the stuff is going to be regional. So I practice in California. I've been a Westerner for a long, long time. Maine folks, the folks in Maine do not have to worry about foxtails, but you know, now you can talk to your friends in California about them. How to stop some bleeding, take care of some wounds. When do you work? They're limping. Bandaging. This will be a brief introduction to bandaging. And then some of the real dangers: heat stroke, snake bites, skunks, fishhook congestions, allergic reaction, toxicities. We had a friend of mine said, don't make me scared to go out when you give this talk, Lissa. I'm like, okay, all right, we won't scare people. First aid kit for adventures. I will note that we will send out a handout that has just about everything that I cover. So it'll have a more of a written presentation, everything we go over here. So you don't have to take notes, but you're certainly welcome to. So first aid kit for adventures. This is a massive list, but it's stuff that you would use as well. Antiseptic wipes, antibiotic ointment. You can use the same for dogs. Tweezers, safety pins, slip leash, which is the slip leash over here. You'll see how we'll use that. I'll go through the bandaged materials a little bit after this. Eye wash, I always have it at home. Benadryl, that's the one medicine you're going to want for sure. Thermometer, really not a bad idea. Lube, Vaseline, baby oil, I will cover that. Styptic powder is if you're trimming nails and you cut a nail too short. I do not take it on hikes because I'm not taking nails, cutting nails there. Poop bags, I added that. First aid tape, waterproof tape, and I like always in my first aid kit for dogs, knee-high pantyhose. Especially if you're going to be somewhere where you are not going to be able to get to a vet pretty quickly. An antibiotic eye ointment, and this is a non-steroidal, this acronym, non-steroidal anti-inflammatory pain reliever. Veterinary specific for your dog, and not every dog can take it, so you have to talk to your vet to have this given to you ahead of time. Honey or Caro syrup, if for low blood sugar, it's not very common in dogs. Okay, courtesy, a little bit my soapbox, because we mentioned poop bags. Treat dog poop like you would human poop. Bury the stuff. It's not part of the natural environment when you've got as many dogs going out with us. It really isn't. Have a trowel handy. I keep mine at the very top of my pack, 6-inch deep. And it's true, leash is really the safest way to hike with your pet. My dogs are bozo heads, right? They see a wild turkey, they're going to streak off. We did have a dog that came into the clinic once, ran chasing a hawk, and he ran off a cliff. It was a 20-foot cliff, and broke 3 bones. So I am a leash advocate. I'm just one of those people. So when you are putting together like backpacking trips, I treat dogs and humans. I'm like, what can we share? So like the multi-tool knife, you're going to have some tweezers in that. Your tent repair kit should have some safety pins. I'll sometimes just bring paracord that can be used as a makeshift leash, and because paracord is always part of my backpacking kit. Baby oil I like. Talk a little bit more about that. Benadryl, plastic bag. So you can share this. But dog specific, I do bring some bandaged materials, and I do bring a thermometer, and this helps you with heat stroke in particular. And there's the dog specific, either booties or some extra socks, and the anti-inflammatory. And when I say I backpack with duct tape, I do. I don't bring the whole roll. I bring this little tiny piece down here that's pretty lightweight. So I also have my first aid kit divided into car camping and backpacking. You know, weight is everything when you're backpacking. So, you know, where I bring a tube of ointment when I'm car camping, I bring the little tiny antibiotic ointments when I'm backpacking. I do a car camping, I'll bring a full bandage kit with cast padding, cling gauze, white tape or first aid tape, and then the vet wrap, which you get from your veterinarian, or it's the same stuff as Coban, which you can get in any drugstore. Backpacking, I'll get a little thinner, and I'll do the nonstick pad, a little bit of antibiotic ointment, maybe the knee-high or tubular bandage right here, white first aid tape, vet wrap, and then again so I don't bring as much as the bulky bandage material. It's not too heavy, but it does add bulk as well. Beauty of baby oil. I learned this a couple years ago. This is great for removing sap from dog paws. Vaseline will probably do it. In a pinch, you can probably use your chapstick, something with a little petroleum oil base. Great for dry skin, chapped lips. Can prevent some human chafing as well. It's part of our toilet kit, if you will. It works very nicely. This is not when you're out about, but this is a great first aid thing to have at home. I would recommend just buying yourself a pair of clippers. You get them online. You're going to probably have to spend about $80, get a good pair. You want a 40 blade, and this is going to help you for hot spots and the puncture wounds. Because what happens when you bring them to the vet, we always clip the hair. You need that in order to really properly clean the wound and to keep them healing well so the hair doesn't get all clogged inside. My two favorite antiseptic sprays now are either Microcin AH or Vetericin. These are non-prescription. You can get them online. I keep one at home all the time. I haven't brought them backpacking yet, but I do often bring them car camping. At home, I'll keep hydrogen peroxide on hand. That's for skunks mostly. We'll go through the recipe later. A little bit for toxicities. The baking soda is also for skunks. And I always keep my cone. It's in the garage. I don't take it backpacking. I really don't bring it car camping, but it's part of my home kit. And while we're speaking of the cone, I did this in the Sage Compassion for Animals talk. We're doing it for you guys now. Instead of the cone of shame, I like to call it the halo of healing. And that's my dog in her halo. It lets her heal well. Julie and I spend a lot of time putting these beautiful stitches and things, take a lot of time, and it's like 2 minutes and the dogs are unraveling all our good work. You have to pay more. Healing gets extended. I'm a big fan of the halo of healing. All right, so you need to know what's normal. Temperature, 100, this is in Fahrenheit, or 8. Don't need to go through all this, but know your normals. And how do you tell when a dog is pale? Well, you have to lift up their lips and look at their gum color. Some dogs have a lot of pigment in their gums, and you have to look hard to find it. The tongue sometimes has pigment, but really know the normals on your dog. Recently with my older dog, she had a collapsing episode and was very pale. And only because I've always looked at her gums, you know, it's like, oh yeah, that is different. And you'll double guess yourself, but the more you look at it in all their various states of awake and alertness, the more you'll feel comfortable saying, that's not right if the time comes. And this stuff too, you know, feeling for the heartbeat and the pulse. The more you can practice and know your dog, the better. And some dogs are really hard. Some cats are very hard, especially those thick little pitty legs. It's hard to find the femoral pulse, but it's there. My little diagram over here, this is the muscle that you feel is kind of a twangy, sinewy kind of muscle. It's right in front of that. You're going to find this red thing. That's the femoral artery. And give yourself some time and kind of roll your fingers back and forth. Don't ever feel it with your thumb. But practice finding your pulse. You want to look at rate and kind of how full it is too. Again, a little hard, but it's a great thing to do with your dog when you're petting your dog. Count the breaths and see if they, you know, at rest, you know if your dog's breathing hard. And dogs, they pant. That's how they cool. Is it labored breathing? Are they panting easily? Dogs shouldn't make much sound when they pant. Those things will be to pay attention to. And checking for dehydration. So in a dog on the right, you want to be able to, let's see if this will, there we go. So you pick up the skin and then snap it back, and the skin should snap right back. That dog is normally hydrated. If you tent up the skin and it stays up, which is actually me on that side, so this is not something to do for humans, that's just my age showing up right there, and it stays up, your pet is dehydrated and needs veterinary care. So, you know, they're panting, they're tired, maybe they're vomiting. You're like, oh, are they getting dehydrated or not? This is a simple test. So when to worry, a temperature too low or too high, and here's the normals, it'll be on your handout. A heart rate of 20, more or less than their normal, or difficulty breathing, or when they get dehydrated. This is when you're like, maybe we should cut the trip short or not go on the trip if you're seeing some of these signs. Do know your pet's medical history, especially the problems, medication, supplement. You know, I just keep a copy folded so that when you are frazzled and at the emergency vet in some town far away, tucked in the hills, you can just hand the thing and say, here, this is what's going on. It's good to know where you could take your pet in an emergency. You know, when you're out on trail, where is the nearest town that's got an emergency clinic or vet clinic? It's a nice part of your planning. Please don't give over-the-counter medications without consulting your veterinarian. There's some things that are very commonly used for people that are deadly for pets. Tylenol, very toxic to cats. They cannot take even a size-adjusted dose. And same with Aleve, for example. Now, dogs can take meloxicam. That's a human NSAID. They cannot take Aleve. So always, always, before you give anything, I think with the only medication I'm covering in this talk is the Benadryl that you can do. Don't believe everything you read on the internet. I really like it when owners come with knowledge that they've gained, but don't believe everything. Now, in treating your dog, all dogs can bite when they're scared, in pain, and so you can use that paracord or that slip leash to do a muzzle, and it is easier said than done, for sure. So this is the leash kind over here on the far left of your screen. They make wonderful muzzles. If you own a short nosed dog that likes to bite, just bring one of these into the vet clinic. We'll love you for that because it makes it so stress-free. And the cone, you can put a cone on. This keeps the dog from biting. Now here's the veterinary clinic secret sauce. It's all very well and good if your dog has a wound in its paw, but unless you can get the dog to hold still, you can't treat it. So if they're standing, what you want to do is come close to your dog. One hand hugs around the neck, and that's going to keep that head from whipping around and trying to bite the person who's treating it. And then the other under their chest to keep them from collapsing and to keep them from shifting back. Lying the dog down, every part of this, of our nurse's body here is doing something. So the dog is lying against her, so that's supported. They can feel she's there against their back. And her hands, her hands are on the paws that are on the down surface. If you're holding that down front paw, this is the secret sauce. That's going to keep them from getting up. And then your arm needs to be gently across, but they need to know you're there, across the neck, not on the trachea, the windpipe part, but the muscle of the neck. This is the position that's going to let you do 90% of the stuff that you need to do to treat your dog's feet or to look at their ear or something. You have to learn how to hold them. So doing this, rewarding your dog for this, giving them little treats when it's not an emergency is by far the best thing to part of your dog's training. And how do you lift your dog? This is a nice, easy way. It does require a fair amount of quadricep strength on our part, but tuck under the rear and under the front. You can take the front hand and go between the front legs as well and have the dog held close to your body as opposed to being out suspended where they don't feel well supported. Emergency transport. You can use trekking poles, branches, and then put any zippered jacket or a sleeping bag inside of them like I've done here. And you've got a 2-person self-care. And what I like about the jacket is that you can put your patient in there and then you can use the sleeves of the jacket to tie over them to give them a little bit of support. This works for people and dogs that you can't just scoop up in one arm. All right, so again, this is some common injuries. Foxtails are our nemesis here. They are grass seeds that are barbed, just so, and the barbs are microscopic. And when dogs go running through tall grass, these barbs come off and they implant themselves up noses, in ears, and then most, just about anywhere. So this poor dog, it didn't come in like that. This dog came in sneezing. We put it under anesthesia and then went in with a scope and this special pliers to pull this enormous thing out. This dog felt so much better right away. So they go up noses, in ears, but also they go in between paws. So part of the, and they sometimes they take a little while to work in, but they work into the skin and then they pick up and migrate all over the place. So prevention is really the best thing. So there's this wonderful hood called Outfox, and you put it on right as you're starting your dog's walk. It's just for foxtail season, which this is in the summer, yeah, late spring and throughout the summer. And they can play ball with it. It also works to keep dogs from picking up food that they shouldn't. So this dog cannot get that chicken bone into its mouth. But my dogs have their Outfox, and I usually avoid areas of foxtails, but they're ubiquitous. And when I can't avoid it, I put this on it. And then you just check their feet 1 to 2 times per week on a regular basis, but daily when you're on the trail, so that you can remove these things before they start to work their way in between the toes. All right, let's talk about bleeding. So this poor dog over here, it looks like a lot of blood, and it's actually not. It's a very small amount of blood. Look at the dog's color on its tongue, very pink, but it's a bleeding ear tip. And when they shake their head, the blood sprays everywhere. It causes a lot of panic, but just remain calm. No dog has ever, I shouldn't say no, dogs rarely bleed out through an ear laceration. It's when they get to those big vessels that are close and deep inside that you have problems. So there's different kinds of bleeding. I put it into 3 categories. There's the part that you can compress, because all bleeding stops when you push on it. That's called compression. There's stuff that's easy to compress, partial compression, and then non-compressible. It's the stuff in the chest and belly. Ears are very easily compressible. So let's look at ears. The best way to do is just put a sock, cut the toe out of a sock or a knee high, that knee high, and you can put it over the dog's head. If you want to add a pad and put the pad on first and then fold the ear in that, you can. And you can even keep the other ear out, and that dog's going to be more comfortable for that. But just holding that ear a little close so they can't keep flapping it around. You can also apply a little bit of tape. So this dog's getting it taped because it's not tolerant. But that's another thing, is you can just tape the ear down. And if your dog has upright ears, you want to tape the ear upright over its head. If it has ears down, tape it down. This is my floppy-eared dog, so we taped her ears down. Bleeding tails, same thing. You look like it's a bloodbath. But you want to put a sock or the knee high, maybe a little bit of tape right over the end, and then you can use tape to tape the leg to the tail to keep it from swinging. And this is just first aid to kind of get you into a veterinarian where they can sedate the dog, maybe stitch the wound, or do a better bandaging job. If they need to have a bowel movement, you'll need to just cut the tape, let them have bowel movement, and tape it back again. All right, with limping. Watching a dog, the front leg is pretty easy to tell if a dog is limping. With the front leg, it's a little bit harder. Just have you watch this video, but remember, when you're watching for gaiting, down is sound. So when a dog puts its good leg down, the head's going to come down. When the dog is putting its painful leg down, the head's going to go back. It's trying to off-weight that head. And so I'll watch a dog walk, and you'll see me kind of nodding my head. Down is sound. So I'm going to play the clip and see if you can tell me, tell yourself what front leg is sore here. We'll play it again. And one more time. This is sometimes all you get, right? Oop. Back to. So she's left front lame. She's coming down harder on her right front. So with lameness, I hear people say all the time, oh, you know, she's not in pain, she's just limping. But they're limping because it hurts. It's just how badly does it hurt. And most dogs have such high play drive. They're not going to whine. They're not going to come to you like, ah. For some, they do, but not for all. But it is pain. So common causes, foot pad injuries, very common on the trail. Strains, sprains, ligament injuries. So start at the nails, put them in that secret sauce position, and start at the nails and work your way methodically up, looking at everything, check the pads, looking for foxtails, bend and move every joint, kind of feel the bone. If they've broken a bone, those are very, very painful. That's what we call a non-weight bearing lameness. They're not going to want to use that leg. The dog had some, she'd sprained her wrist, my little border collie, chasing a ball. Shocking, I know, but that was her. So probably the most common injury we see on trail are paw wounds. So they get abrasions, they get sore. These are probably a thing to bandage, put booties on. I'll go through some options. You can do some cool water if you want to put some baby oil or some kind of salve that you have that's great. Keep them from licking as best you can. And really the way to prevent this is trying to condition the paw. So while you're getting in shape for your trip, take the dog with you and they can get their paws a little bit in shape for a rough trail. I don't like booties in general. They're necessary for some things. Dogs really hate them unless they really need them. But conditioning the pads to just exposing them longer and longer times, the kind of surface you're going to be on. Really important if you're going to plan on being out for a long time, like a week-long backpacking trip. So on the trail, made on trail, you can take that knee high and put a little duct tape on the bottom, and there you have it. Picture right there. And again, I bring a little folded up thing of duct tape, or one of my tent repair kits has this nice roll right here. Now, sometimes this will come right off. So I put a little bit of tape right between the wrist and where the flare is of the toe bones. There's a nice, it's more narrow in that area. Don't put it on too tight, just tight enough to keep it on. So you'll need to check this periodically, but you shouldn't have to cinch that down, but that can keep it on. And you'll know that they were painful and the booty helps because you'll see them limp less. If the booty makes them more uncomfortable, take it off. They don't. Then there are lots and lots of brands of dog boots. These top two are Muttlucks, probably have the most success with these. There's a different variety. I also like the sock dipped in rubber. This is what I will bring backpacking. Or you know, if I'm not super conscious of weight, but I like these. And you can also add a little bit of tape if these keep falling off. But these are lightweight and they can still feel through where they are on the ground. The really hard rubber, it's like us trying to walk with I don't know, like a boot on, a big ski boot. It's very clunky, it's very awkward. How to clean the wound. So this is our border collie. Every year, the first day in the swimming pool, she runs around like a maniac. Again, shocking. And often we'll get this. So this is always 1 week of pain, and then her paws are conditioned for the rest of the season. Here's a great way to clean it. We take a plastic bag with tiny little bit of soap in it and tighten our hand around it, and then we squish the bag, and it's like a jacuzzi. If you have warm water, they tolerate this much better than if they had cold water. So. And then you put the cone on so she doesn't lick. And we didn't put booties on for this the first day or two when they were much more pink. We did. Then after that, we just let her take it easy. And she was healed in about 2 weeks. So eternity for border collie. This is a pad laceration. This is going to need stitches. This will not heal on its own. There's just too much pressure always pulling that apart. So bandage that up with a bootie, homemade, on trail. Take the weight off the dog and come on home because this is going to need stitches. These take 2 to 3 weeks to heal, even with stitches. They don't bleed all that much. They do like right in the beginning, but then they kind of stop. So if it's not the paw, what is it? You know, if it's minor, you can maybe just take some weight off, cut their mileage, put them on a leash. Maybe you're anti-inflammatory and see if they can kind of work through it. And if things aren't getting better, you should come home. They can have lacerations. So we're back to the bleeding area. These are going to need some bandaging and compression. This is compressible because you can get there. And some require marked compression. And my little diagram here illustrates that sometimes when you've got a cut, the artery is under a fair amount of tension and it snaps up. Snap is not the right word, but it retracts a little bit under the skin. So you need to put pressure not only over the cut, but about an inch above that as well. And this is put a bandage on and come on home and have a vet, because often these tendons are involved. And if you don't reconstruct the tendons, your dog's foot's not going to work properly. Rear legs, this dog might have a cruciate tear, need to come home. But if they're touching, what we call toe touching or not weight bearing, gotta stop, come on back, get it figured out. Good news is most dogs can hike out on their own, right? If this happened to us, that's a big deal. But dogs come home on their 3 legs. Just take up their weight, put them on a leash, and come on home. Skin wounds, to get these things to heal, they really need to not lick it. It's hard to shave hair when you're on the trail, but warm water, soap, keep them from licking. You can spray it with the Vatiricin, Microcin, put a little bandage on. We'll go through some bandaging. Puncture holes, again, keep it clean, warm water. These are bite wounds. Best to come home because there could be pocketing and the bacteria get in and under the skin, and those need veterinary care. But in the meantime, just keep it clean, spray an antiseptic there until you can get home. Lacerations, they don't bleed much from this. It looks really gross, but this is very superficial. So if you can, flap the skin back, maybe put a little bit of just a warm, moist gauze there. No one travels with KY jelly, but if you're at home, you could put that in because that's a water-based thing that is okay on this, the water-based lubricant on the skin. Put a t-shirt so you can kind of cover this, or maybe tape around the dog's thorax, just around its chest, just to try and keep this from flapping too much. But we should see this. This was an evisceration from a bite wound. That sometimes happens, and some guts pop out. Good to cover that. Safety of a clean towel. This is part of my, in a car, I always have a towel, dog towel in the car. Safety pins, tape. There's clamps here. Towel clamps are clamped to the towel, not the dog here. So basic bandages and splints. This is a broken bone. This is actually a piece of bone popping through. You're going to want to cover that. Again, if you don't have the bandage material, a hiking sock and some tape to cover over this. But warm water, if you can, clean it. Apply some gentle pressure to control the bleeding, and then some kind of support for this. This is the basics for the bandaging. We do want to include the paw as well, otherwise the toes will often swell. Bandages can be dangerous if too tight, and so what you want is a thickly padded bandage. And I'll go through this. You have this primary layers against the wound, secondary layers the bulk, third layer tightens it down, and the outer layer is a little bit of protection like tape, just to keep it from getting too dirty. So here you got your dog lying down. You've got your vet secret sauce holding that down front paw. We like to put stirrups on. You don't have to do that on trail, but this is just taped to the fur, not the skin. And you'll see how this is helpful to keep a bandage from slipping. We're going to cover our wound. And then we start from the bottom with the cast padding. Again, on the trail, you can use a sock. You start from the bottom and go up, and we'll probably put about 3 to 4 layers of this on. Then we're going to cinch it down a little bit with our cling gauze. Then we're going to twist and put up the stirrups, and that's going to help keep the bandage from slipping off. And then we cover it with the vet wrap or Coban. Don't put this too tight. This can really cut off circulation if it's too tight. Now, if the bandage gets wet, it needs to be changed in 24 hours. That's why I don't like these out camping or backpacking. Well, so I'll use the booties instead. But you don't want these to get wet and stay wet. You need to take it off. If blood soaks through, apply more bandage material or designate someone to hold it at the bleeding area, applying that compression. If you've put the bandage on too tight, the toes are going to swell. And you're like, wait, I just covered those toes. Well, look at the toenail. If the toenails start to separate, those are the toes swelling, and your bandage is too tight, and you're going to need to take it all off and put it back on again. And we teach this to the police dog handlers, particularly when these dogs are out on the field on narcotics runs or stuff. And we've had a couple that had bad lacerations from a broken beer bottle and some sheet metal. And it gets right down to the artery. And we've taught them how to put on these compression bandages so they can get their dog in. We've saved 2 lives so far from the dogs we've given. But this is not material that everyone has, but it's a good idea. So this is why I said quick bandage. If you don't have the cast material, you can use a sock and this instead. And I've got this kind of white sock material, and then the cling gauze or just the tape. So again, bandages can be dangerous. They can cut off circulation. Wet bandages will increase your risk of infection. If you put on too tight on the chest, it can keep the dog from taking a deep breath. And an improperly placed splint can worsen an injury. So just, if you're not comfortable putting it on, don't put it on. I like this diagram to show how hard it is to bandage a dog or cat, because their thigh bone and arm bone are basically part of their body, where for us, they're external, they come off of our body. You can only splint up to the elbow and up to the knee in dogs. I like the SAM splint. So this is something that a lot of people carry for themselves, and this is taped right on a dog. That's okay to do. It's a nice cup. It's not going to be too tight. You can check the toes if you've got a broken bone or something that's flopping. Again, if you're like, oh, I don't know if it needs a splint, you're probably okay. But if you're looking at it like, oh, this is flopping or it's super crooked, then you can put a splint on. I've done splints with towels. Now these don't stay on dogs when they're walking. This is for a dog that's lying down and you're trying to transport somewhere. All right, we're going to shift away from bandagings into burns. Sunburns, they do happen in dogs. Our poor little border collie needs a little dot of sunscreen for big days out in the sun. Try and avoid zinc oxide, but almost anything can work. They can also get thermal burns from hot rocks, the asphalt, the stoves, fires. You want to cool it right away. That's the main treatment, is cooling any burn. That's instinctive. Same thing that you would do with us. And then burns hurt, as you know. So if you have some pain medication given to you by your veterinarian, you can do that. But much more deadly and common, unfortunately, is heat stroke. Too much heat produced, too little loss. So the big risk factors are older dogs, dogs with smushed face noses, they're unfit, heart murmurs. It really can happen to any dog, and it can happen very, very quickly. Yep, our poor little short-faced dogs, they have compressed or bony structures, but all the nose and the palate tissue are just as long. And so there's just way more tissue in there. And it provides, it means that there's much less room for air, basically. Now, dogs do lose heat mostly through panting. That's our number one. They do not sweat. Their paws, their pads will sweat some, but that's it. They can radiate some heat. They can lie on something cool and they'll lose some heat. And dark dogs absorb more heat. Just like with the black Great Dane, we had to make, in the hot sun, we made her a white cape that she loved, kept her a little bit cooler. Funny to see. Signs of hypothermia or heat stroke. These can be very subtle, and it's heavy panting that continues when resting, or they're just a little agitated. High heart rate, this is where your normals come in. Bounding pulses in a dog that seems to be kind of slowing down on the trail. Increased drooling. The body is desperately trying to cool off, and it's just putting more water to the mouth cavity and hoping that that can help it cool off more quickly. As it progresses, you get the brick red gums. And these are dogs that are just not themselves. They're not obeying commands. A couple police dogs that just all they could do was not make eye contact and kind of stare off into space. And these dogs were starting to cook, like 105. There was a police officer that helped explain that to the other ones. And then as it progresses, you get to the bad news stuff, really bad news, vomiting, diarrhea. This is where having that thermometer on trail, because you're like, is it heat stroke or is he just tired, you know? So if you have greater than 105, time to stop and cool, because otherwise they die. All kinds of bad things happen in the body. So stop all activity, use cool water, not ice water, because that makes the skin vessels contract, and we want these to expand. You have to wet to the skin, and then the water that you're providing is like sweat to us. So you're allowing the dogs to kind of cool off like we would cool off. You have to wet them to the skin. If you're near a mountain lake, I know it feels like ice, but get them wet with any kind of water. Don't cover them in ice. You can put a little bit in the groin or armpit area, but not all over. And it's important to stop active cooling when the temperature is 102, because they will continue to go down. Statistics are, if you can get to a veterinarian with heat stroke, survival is 83% of dogs will survive if they can be seen by a vet in less than 90 minutes. So if you're less than 90 minutes away, you need to be looking for this and treating early for this, or you are going to lose your dog. Hypothermia happens in dogs too. You know, persistent shivering, weakness. If you're looking at your dog like, I wonder if it's too cold for him, it probably is. Lack of shivering's a late sign. Again, you're going to have that pale gums, low heart rate. Treatment, rewarming. So moderate to severe, that lack of shivering should come in. Frostbite, they can get frostbite as well, again, with the tips with their extremities. You'll see pain initially in these areas, and then the skin will start to change, white, and then gray, and then black. But that's much, much later, days and days later. Dogs get altitude sickness too. Very hard, because the dog can't tell you it's got a headache, and that's often what you see. But fatigue, exercise intolerance, weakness, increased rate of breathing, and then sometimes they get just like a stupor. You can see if they want to eat, right? People lose their appetite. No one's that I know really knows that's a hard finding, but if dogs normally like to eat, they're like, maybe not. Only treatment, descend, and descend right away. All right, snake bites. This is West Coast stuff. So I haven't got all the United States and certainly not Australian snakes in here. We deal mostly with the rattler. Rattlesnake venom contains enzymes that break down the tissue, then thin the blood. Some can cause neurologic signs like seizures. And the thing is that you never know how much venom is injected at the time of a snake bite. An older, more experienced snake knows that your dog's not prey and they're just going to bite, and maybe it's a dry bite. Baby young rattlers panic and they give you a ton of venom. So you just always have to treat each bite like a bad one. Sometimes you're not sure. Dogs, it gives a little yelp and then comes back, and maybe they're limping or they seem kind of off. We'll take a look. Do a good exam all over. And sometimes you have to clip the fur, especially if they're like licking some area. Hard to do on trail, but look for the 2 punctures. That's your telltale sign. As time goes on, swelling starts. These hurt too. But you want to keep the dog calm, put them on a leash, carry them. You want to decrease all activity. Do not ice, do not place tourniquets, do not use suction devices. You basically have to get to a vet. We're going to clip, clean, pain medications. We're going to do blood tests to try and determine how much venom might be there. And we can give anti-venom, but probably more important is fluids and pain medications and just strict rest. There is a vaccine. It's not 100% by any means, but if you are in a high rattlesnake area and your dog's off leash, then I did it with my dogs. And there is aversion training, because dogs won't, sometimes they learn, but not reliably. Here's the 2 punctures. We're here for snake bite. Most dogs live through this, but it's sometimes a bit of a road to get them through. Skunks, more of a nuisance. Dogs can get sprayed right in the face. It's a bit of an irritant. It's bad smell. Here's your the best skunk, and I have treated lots of skunks in my dogs, but I'm very happy with this mixture, better than any kind of tomato juice or over the counter. But there's the recipe: quart of hydrogen peroxide, baking soda, and Dawn dishwashing liquid. You probably have to wash them a couple times. And my tip is to do the head and the ears very, very last. Get all the body and everything else. But once you start washing the ears, that's when they really start shaking their head and sharing their bath with you. Just a quick tip on dog fights, breaking up a dog fight. You can startle them. You can use pepper spray or this technique where both owners at the same time grab the rear legs of their dogs. So this dog's kind of biting on something, and they're demonstrating the wheelbarrow technique of trying to pull a dog off, but both owners have to do that at the same time. All right, fish hook. My main thing with a fish hook is that if you see fishing line come out of the dog's mouth or a hook in it, do not pull. Take it, cut the line short, get it to a vet, because we can get that out with a scope if you have not pulled. If you pull it, you're going to set the hook and probably need surgery to pull it out. So do not pull. Insect bites, the main thing with ticks is to just spend some time maybe trying to agitate the tick before pulling it out. And with bees and wasps, with a stinger, the best way to remove the stinger is not to squeeze and pull it out, but to take a credit card against the skin, and that's with you too, and just whisk the stinger out. Allergic reactions are pretty obvious. You get swelling. Insect stings, vaccines, food, environmental allergens. This is when you bring Benadryl. Benadryl is very safe, only Benadryl. 1 milligram per pound every 8 hours. That's 2 capsules per 50-pound dog. I have this with my kid. Talk to your vet before inducing vomiting. Mushrooms, call your vet. So you can induce vomiting with a hydrogen peroxide, but I would just prefer you call your vet for this. Probably the main thing is raisins are toxic, and chocolate is toxic, and some macadamia nuts and xylitol. So be very careful about your gorp and all snacks. So the last thing you need to do is just have your dog get into your supply of chocolate or raisins, because that's an instant trip to your veterinarian. I shouldn't say that. With the chocolate, there's chocolate calculators of how big your dog is and how much they ate and how dark the chocolate is. Those are online. Grapes and raisins, some dogs seem affected by it, not all. We don't know why, but we treat every dog. So in your handout, places to learn a little bit more, there's not a lot of pet first aid out there, but it's there. Hopefully everyone's still awake. Your homework, practice assessing your vitals, practice the secret sauce, mess with their paws so they're used to you doing it. We hope this information helps. All right, I'm going to take some questions now.
Great. Hey, thanks, Liz, for all that information. I was trying to answer you all in the question box as we went, but there was a couple really good ones that I know I've heard these questions before. You mentioned with the snake bites, not to use a suction device, and I know that's out there. So if you can say why that's not recommended.
Well, it causes more trauma. We want not a very concentrated area of the snake venom. You certainly don't want to be suctioning your mouth, but I don't think it works. It just causes more tissue trauma. We want as little trauma as possible and let the body just deal with it. I don't want to concentrate it.
Great. And I had a couple questions about how to toughen pads. And I know you kind of went into it, but I just wanted to bring this up because we had a mountain biker who likes to take her dog mountain biking and every time seems to get a cut, and also an ultra marathoner. Have you taken your border collie for 50 to 100 miles?
No, she poops out after one. She goes all in and then she's done.
So any specific anything more that you can say about how these really active people can get their dogs pads even tougher, because they just seem to constantly have issues?
You might be the ones that need to just wear the protective layer. I'm not sure. So if you're always running into issues despite the conditioning that you have, it just might be a little bit too much. The mushers put booties on their dogs. It's just what they need. And so maybe partway through you as they might start to get sore, put the booties on. And if dogs are comfortable in it, and if they can grip, that's why I like those, the rubber coated socks. You might go through a pair each time, but those are so movable as opposed to the more rigid booties.
Oh, that's great. And actually the ultra marathoner also asked the question about nutrition. And you mentioned the mushers, because obviously there's been a lot of work on nutrition in sled dogs. Is there any other good resources out there about these kind of extra active dogs?
Not that I know per se. I know there's veterinary nutritionists. So UC Davis has a veterinary nutrition program, and you can ask for an online consult. So yeah, they don't necessarily need to see your dogs, and they may be able to help you calculate kind of calorie expenditure and what you need to do. I know when I had a puppy, and she was a year, and we were going to do a big day on the river. So I got her a vest because I knew she was a little out of shape. So she got a flotation vest. And then I fed her probably every hour, just so there was always some food in her, because I knew her expenditure was immense. And I didn't want to fill her stomach with a bunch of kibble. So I fed her hourly. She did great, but that was just me kind of winging it. But, you know, as much as dogs kind of appear robust, they need some special care. But I would do the veterinary nutritionist, because that's going to be pretty specific.
Right. And can you go to your slide on the first aid kit? We've had a couple questions on that, and just maybe refresh everybody your list. And I'm just going to answer a couple of questions in the chat. Yeah.
Sorry, it's making everybody look away. I should have students. This is in the notes. And then what's also in the notes is the backpacking bare minimum and the bandage materials. So this will be sent out afterwards. And kind of play around with these things. And this is in the notes as well. I hope that covered it.
Yeah, I think so. Oh, the heat exhaustion. There's a question about what can we do if you come across somebody or one of your dogs is getting heat exhausted. Initial treatment.
Initial treatment really is just stopping all activity and cooling. And you need water. So this is a time to beg, borrow, and steal somebody's water, and take your water bottle and get their fur wet. They need that extra moisture so they can start to literally sweat. Offer them water if they can drink some water. Food is not all that helpful to try and do, but it's get in the shade, stop all activity, water to cool them off.
Great. And Caitlin's asking about, is there a certain temperature at which you recommend not to take dogs out hiking?
Well, my adage is, if I look at something, I'm like, oh, I wonder if it's too hot for my dog. It probably is. So if you put your hand on the pavement and it's uncomfortable for your hand, that's going to be too hot for your dog's feet. And they just, I would send my kids out cross-country running, but I wouldn't send the dog with them, because I knew they could deal with the heat better than my dog. So I'm very, very protective about it. And partly I'm traumatized because I see these dogs come in. You know, in the West, don't take your dog out at 3. That's probably the worst and hottest time. So it's just better to, if you're wondering if it's too hot, it probably is.
And can you review again why ice isn't recommended for hypothermia?
Yep. So when you put ice on your hand, your body's like, whoa, that's too cold, and it constricts the vessels. And what we want is vessels to be wide open so that they can help keep the circulation going and cool the skin a little bit. So a little ice in some areas is fine, but you definitely don't want it done, because it's going to decrease their ability to cool. again, constricting the vessels. We want them dilated and giving off heat.
Okay. Sorry, I was typing and listening at the same time, and you all heard that. I apologize.
I'm glad you're doing it. I'll show up my, this is my favorite tent repair kit. Again, it's got zip cord and things to, big fan of this one. So I take this everywhere, backpacking, car camping. That's my other tip. This is not in your notes, but gear aid, ultralight gear aid.
I think I've gotten everything and I've caught up. Sierra, do you see any that we missed?
No, I don't see any that we missed. Man, those are some great questions. Thank you for fielding all of those.
Thanks, Julie. Yeah, it's this onslaught of information, you know, quickly kind of going from one topic to the next. It's hard with webinars, you know. Sometimes I like to look out over people and either their eyes are glazing over, I'm like, ooh, I'm going too fast, or people are nodding, I'm like, okay, this is helpful information. So sorry that it's, you know, this remoteness is not good, but it means that we can connect with people all over the country and the world, and that to me is it's an okay trade-off. But I just never know how it's going until we're all done.
Yes, well, I see so many thank yous. People are adding all these thank yous and kudos in the chat box, so really appreciate that. Keep those coming. Dr. Richardson, Dr. Smith, thank you so much for volunteering your time. Thank you for sharing all your expertise tonight. This was so great, so helpful. I have 2 dogs and I took copious notes on all the things I could be doing better for them. So thank you. Like we talked about in the beginning, we'll be recording this session and adding it to the handouts that Dr. Richardson is providing. So that will come in a follow-up email to everyone who's here tonight and everyone who registered but couldn't quite make it. We were also talking in the beginning about how today is National Dog Day.
Right.
And, you know, I would like to take credit for being that clever, but this just happened. We happened to plan this event on National Dog Day, and I think that's a sign, and it's so awesome.
I think that's what you do. Take it as a sign. This was meant to be. And thank you all for sharing your time and supporting SheJumps and learning. Yeah.
Awesome. I see still lots of thanks, but no more questions that have come in. So I think everything is good to go. Again, thank you for joining us tonight. We really appreciate you, and check out Sage Compassion for Animals. They're doing wonderful work, and find out how you can get involved and help. We appreciate it. Have a good night, everybody.
Bye, everyone.
Bye. Take care.
Bye.